Data and information has always been there, right? And when we talk about the healthcare setting, it has a lot of confidential information of patients' health and their family and their next of kin. So we are the custodians of a lot of confidential data, very sensitive data, but that data has always been there. But the point is that it was always paper-based system. With the Aga Khan University Hospital, what we have done in the past 6-7 months is that we have now migrated to electronic health record system. So we selected, and it's an AKUH initiative, the Aga Khan Development Network. We have over 700 healthcare facilities. The idea is that we will migrate to electronic health record system across the AKUH Health. And we were the guinea pigs in Nairobi. So this hospital in Nairobi, we implemented the EHR system, the electronic health record system, to be the first. Electronic health record system is whereby the entire patient file, all the records are electronic. The clinical protocols are embedded within the system. The pharmacy orders, the lab orders, the radiology orders, even the scans for everything is now electronically within the system. It ensures efficient care, timely care. Because let's say if you are in a center in Buruburu and you are transferred to the main hospital, you do not have to carry your paper file. Electronically the data is available, same data which is on the server within the main hospital, and then the care can be accessed anywhere within the AKUH network. So that's beneficial, and it's also beneficial for the physician because they are able to access that information, that patient medical records electronically from wherever they want. So it ensures efficient care, it ensures timely care. And then research has shown that the timely and efficient care leads to better clinical outcomes. So this initiative of electronic health record is going to cost tens of millions of dollars across AKUH N, but for this hospital, it has costed us $12 million, call it 1.5 billion shillings. From the patient perspective, let's say if you are diabetic patients require to do sugar tests every month. Now, it's very difficult to keep those paper-based records with you all the time, right? Now with electronic health system, we have patient portal, which you can download it on your phone. Now, if you want to track your history of your sugar levels, that history is available with a click of a button. So you can see how your diabetes and your results are moving up and down, right? And then if it's going up, and God forbid, then you can do the timely intervention. You can go speak to your doctor that this medication is not working, right? So it can help you self-diagnose as well. Because the medical records are available electronically within the network, within the system. When the system is implemented across AKUH network, the 700 facilities that I talked about, there are many advantages. First advantage is the efficient and the timely care for the patient that I mentioned. That will lead to better clinical outcomes. Second advantage is that all that data will allow us to do research, right? Because that millions of patients who are seen across AKUH N Health every year, that information will be available. So if you want to do research on cancer, let's say on breast cancer, with different population, we can do that research. And with this hospital, as you know, is not just a hospital, it's a university hospital. So we have trainee doctors and nurses. So that data will be available for their research, and it will be available for the training purposes of the doctors as well. So there are multiple of benefits. When you have paper-based data, you have to go through stacks of files to do that research. Now it will be available, that information is readily available. So your research, your education, and your care becomes much more efficient, much more timely, which will hopefully give better clinical outcomes over time. All the data that we have within this hospital is not outside of Kenya. Those are within the servers, within Nairobi, within Kenya. So that's one part. The second part is that we have been seeking advice from the Office of the Data Protection. We are working hand in hand. We are seeking the advice from the regulator. Are we doing anything wrong? Are we doing something which is outside of law? So we are walking the journey. This phenomena is new. It's new for everyone, right? So, and nobody can claim that they know it all. So we have to work with the regulator to make sure that we are always on the right side of the law. But as far as data is concerned, for our Kenyan patients, the data is here. And if it is required for research purposes, it happens all over the world. You anonymize the data. Right? You don't have to say that this is Rashid Khalani's medical records. It says this is patient 1, 2, 3's data. And then you do research on that. Because the objective of the research is not to identify which patient is. The objective of the research is to understand the underlying conditions and then go for intervention. So you can anonymize the data as well. There is a marked shift in the different industries. Look at hotel industry. The biggest hotel chain doesn't own a hotel. Airbnb, the biggest taxi company, doesn't own a single hot taxi. Uber and Bolt and so many others. I think so. There are shifts in industries. I think we are seeing the shift in the healthcare as well, where the artificial intelligence can predict data, looking at the scans, looking at the reports more accurately than human eyes. Right? So that's the shift. But that can only happen when the records are electronically available. AI is all about computing power. Right? But once you have that data, then you can use the computing power to do research and to use artificial intelligence for your interventions. So that this journey of electronic health records will help us in shaping the health industry across Kenya as well. So there is a lot of research that is going on across the world that looking at different diagnoses, looking at your eyes. Computers can predict if you're going to have any heart diseases. So that research is happening around the world. We want to bring that research here. It's a proud moment for all of us. We are the only hospital in Kenya and second in Africa to become the center of excellence for heart attacks. What is Center of Excellence for Heart Attacks? Joint Commission International, they do audits, quality audits of different clinical programs. Back in 2013, 10 years back, we became the first hospital to get JCI accreditation in Kenya. Okay? And that Joint Commission accreditation is a hospital-wide. There are 1,300 standards for Joint Commission. That is hospital-wide. Now, break down the hospital into different clinical programs. If you take any hospital, there are different clinical programs. There are heart programs, neuro programs, cancer programs, maternal programs, orthopedic programs, surgical programs, etc., etc. Now we are going into this clinical care certifications as well. So first we picked heart attacks as a clinical program. From whatever your entry point is, from clinics, from accident and emergency, if you have a chest pain, if you are having a heart attack, what are the clinical protocols that are followed? What are the standards that are supposed to be followed? Right? So we became the Center of Excellence. We got the certification which is called CCPC, Clinical Care Program Certification from the Joint Commission, which looks at the standard of care, which looks at the clinical protocol. So now we are the only hospital in Kenya and the second in Africa to become the Center of Excellence for Heart Attacks, which ensures standardization of care. And standardization leads to better clinical outcomes. Absolutely, for the emergency cases. Heart attacks are always emergencies. As a matter of fact, although we are a teaching hospital, although we are JCI and all these quality standards, I think we do not even get the differential payout from the insurance companies or from NHIF, right? But we are a teaching hospital, it's our choice. We invest in quality, it's our choice, right? We are doing it for the sake of the patients. So we do not get any subsidy or any support from the government or from corporate partners, but we do understand the agenda for access. This hospital spends 300 to 350 million shillings every year on patient welfare. These are local patients who come to our clinics or to our hospitals. They are diagnosed with cancer or with heart diseases or with neuro diseases, and they cannot afford the care. So we use patient welfare program, our internally generated patient welfare program, to treat those patients. Thousands of patients are treated through our patient welfare. As I said, we spend over 300 million shillings every year. And then we invest in academic agenda. I think the latest number is 800 million to 1 billion shillings that we invest in our academic programs. And I don't call it a spending, it's an investment in human capital. I don't think any other private hospital spends that kind of money on education programs like this hospital.